I'm Perry Hooper. I'm a sports medicine physician here at Southern Orthopedic Surgeons. I'm actually from the area. I was born and raised here, went to Trinity High School and played football and multiple sports there. I was fortunate enough to go on to play at Auburn after that and spent 4 years at Auburn University. And then did medical school in Georgia and then matched at Cleveland Clinic for my orthopedic surgery residency and my fellowship. There I really learned a lot about myself and how I wanted to run my practice and really fell in love with sports medicine. We had the opportunity to take care of the Cleveland Indians, now the Guardians, the Cleveland Cavaliers, multiple colleges and high schools, and that's basically how I wanted my practice to be when I moved back here. And so me and my wife moved back here with our 3 kids, and we've been, providing sports medicine care for these athletes, ever since. With myself, Dr. Worley, and several of the nurse practitioners, we provide care for Alabama State, Huntington College, Faulkner University, Auburn University, Montgomery, and several of the high schools, along with the Montgomery Biscuits, the Tampa Bay Rays baseball affiliate. That's really where I find my drive, is to take care of these athletes. Oftentimes we see them on their worst days. They are frustrated, devastated at times with their injury, and to be able to get them back, whether it's through therapy or surgical care, to get back on the field is the highlight. I'm very fortunate that I have that opportunity to do that in a place that I grew up. It's funny how things evolve. I do several different surgeries. I do a lot of arthroscopy surgery in the shoulder, hip, and knee. The bread and butter surgery in orthopedics is the reconstruction of the anterior cruciate ligament. I do a lot of those in college and high school athletes, and that is the one that takes months and oftentimes 1 year to get all the way back to where that athlete was before. So we do that very commonly, and that has very reproducible, satisfactory results for the athlete. Also enjoy hip arthroscopy to fix labral tears and shoulder arthroscopy in a bunch of the football athletes to get them back. I enjoy all aspects of sports medicine, arthroscopic care, basically. It's hard to say one. I was never able to play professionally, and certainly that's something I had an initial drive to do. But I know I wanted to stay in that world. I knew I wanted to be involved in all things sports, and that fit really well with my sort of science-based brain, and to get involved in medicine and provide musculoskeletal care for the athlete. That's really a roundabout way of saying I just wanted to be a part of that team structured approach for the athlete. There's more and more evidence with non-invasive care and regenerative medicine. And the most predictable way to do that in the office is through a therapy called platelet-rich plasma, or PRP. That's where we take the own patient or athlete's blood here in the office, we spin it down the centrifuge and get these growth factors out of that sample, and then we inject that into the troubled area, whether that's the shoulder, hip, elbow, or knee. And it works really well for early arthritis, partial tears of tendons, and tendinopathy or tendonitis. So obviously athletes deal with a lot of those bumps and bruises and wear and tear injuries, and it's really become a game changer. I just enjoy my practice. I enjoy people that knew my grandfather and my parents, and I enjoy former coaches that come back and see me, that I see still on the sidelines. Several of the coaches here either played with me in high school or played at Huntington College with Dr. Worley, and to have that sort of community environment here, it's almost unmatched in other places.